Welcome to our show, Ask Your Doctor. I am your host, Shavani Raj. So, for today's episode, we have Dr. Sanghvi. So, Dr. Sanghvi is a board certified dermatologist and fellow of the American Academy of Dermatology, FAAD. She spent a decade studying and assimilating everything about skin from both the Western scientific angle of medication science, cosmetic lasers, and also injectables, and the Eastern integrative angle of Ayurveda, Chinese medicine, and functional medicine with herbs and supplements diet. Now, without any further delay, let us welcome Doctor. Hello, Doctor. I hope you're doing well.
Hi, thank you so much for having me. I'm very excited to be on the show.
Yes, same here, Doctor. It's wonderful having you on our show. So, first of all, Doctor, can you please introduce a little about yourself and what you do? Where are you from exactly in New York?
So, my name is Dr. Asmi Sanghvi, and I'm a medical and cosmetic dermatologist working in a private practice in New York City. Now, I have always been fascinated with the concepts of wellness and beauty, and this drove me to study dermatology, studying the skin, which is our largest organ and is a marker of beauty from the outside, but also a marker of wellness from the inside. Now, I did the traditional route of I went to medical school, I did a dermatology residency, and now I'm unattending at the Mount Sinai School of Medicine. But I was always interested in a more whole person approach. So I did extra training and I trained under a celebrity dermatologist learning about lasers, injectables, and devices. And I also did an integrative fellowship where I learned about Ayurvedic medicine, traditional Chinese medicine, and Western botanical medicine, and evidence behind using these practices to treat skin disease. I also did study Ayurvedic nutrition and culinary arts so I could learn how to nourish your skin from the inside.
Yes. So, Doctor, first of all, let me tell you, I'm your hugest fan of your Instagram page because when I checked it, I loved how you incorporated good skin with great food. So, can you please tell the viewers watching the show right now how important is food? Because I checked out your recent reel and it said something about anti-aging breakfast. So, if I'm not wrong, can you please tell the viewers about how great food is associated with great skin?
Great food is associated with great skin, exactly as you said. And we all kind of know intuitively that eating vegetables and fruit and whole unprocessed foods will help our skin and make us look good. But evidence actually shows that specific foods and specific nutrients help with certain skin conditions. So if you deal with acne, there's certain foods that are good for acne. If you deal with rosacea, there's foods that help with redness. If you have pigment or melasma, there's foods that can actually help with that. And if you have signs of early aging, like wrinkles and texture, there are certain foods and nutrients that can help get rid of wrinkles or at least make them look better.
Skin problems. So, what exactly do you deal with when with your patients? So, what are some common skin problems that you deal with? I think a lot of people from different ages come to you. So, can you please tell the viewers how you can help them in future?
Yeah, so I specialize in aesthetics, and that's the art of making people look beautiful and reversing signs of aging. And I do this through really three parts. Part one is looking at skin quality, and this comes from treating dermatologic conditions like acne, rosacea, melasma, hair loss, or premature aging. And this is using prescriptions, using topical medications, using skincare routine, but also using lasers. And then the second part is I help with reshaping. So this is using devices and injectables to volumize faces, lift skin, smooth out large pores and cellulite, and add muscle. And finally, the last part comes with inner radiance, and that comes from lifestyle and diet and stress management.
Yes. So, Doctor, I've also read on your website that you have also studied Ayurveda. So, can you tell us, I think Ayurveda is one of the oldest, medicinal practices out there. Mm-hmm. And can you please tell us how Ayurveda can be incorporated for great skin?
Yes, so good question. Ayurveda actually really inspires the way I practice. In the Ayurvedic philosophy of medicine, the idea is any skin concern you have is due to an imbalance. So the way you treat that skin condition is by getting the patient back into balance. And this comes from the whole inner radiance, making sure their lifestyle is more conducive to the skin they want, looking at their diet, looking at their exercise, and how they manage stress.
Yes. So doctor, now let's get on to the skin problems. One of the most common skin problem on this planet, I think, is acne. And there's, of course, different types of acne. And it's not that, acne is limited to certain type of age groups. It happens from, when you're a teenager and, it depends. So can you please tell us what are some different types of acnes, and can you maybe in short explain about the different types of acnes and some basic treatments that one can incorporate to control it?
With this, I can talk about the different types of acne, but to really get a thorough diagnosis and treatment, I would like to first start with, you want to see a dermatologist. But the four kind of categories of acne is, one is inflammatory, and this is your red papules or your pustules. Second is comedonal, and this is whiteheads, blackheads. Third is hormonal, and this is the type of acne that's associated with PCOS or irregular periods, or that shows up that week before your menses is supposed to start, and it usually shows up around the jawline. And finally, the fourth one is cystic. So for the inflammatory acne, I like washing your face with a salicylic acid wash, which is a BHA, and using a topical antibiotic cream like clindamycin. For the comedonal acne, the blackheads, whiteheads, I really like washing with a benzoyl peroxide and using a retinol to clear that. For the hormonal type of acne, I like using a prescription cream called Dapsone. And if it's really bad, then you may want to think about a pill called spironolactone, which works really well for regulating that hormonal imbalance. And then finally, for cystic acne, you want to be careful about cystic acne because when you have acne that's deep and painful, it's a high risk for scars. And if you get scars from acne, that can be permanent. So you may want to think about more aggressive treatments like Accutane. Now, there is a laser that we have in our office that's brand new. It's called Avaclear. And this laser, the way it works is shrinking the sebaceous gland. The sebaceous gland is what creates that sebum that starts the cascade of creating all four types of acne. So if you use this acne laser, your skin will be cleared without any oral medications, any topicals. It's as good as Accutane, but none of the side effects.
Yes. So doctor, now that, let's get into some of the chemicals, that are being used and that are famous nowadays. You open Instagram, you see something called as AHAs, BHAs, retinols, vitamin C, and these are pretty confusing for somebody who don't really know, apart from dermatologists and, estheticians, these are some things that they don't know, and people often mistaken them and, they use them and instead of healing it, it ruins it. So can you in detail explain us what exactly are, I'll ask you one by one, so maybe in that way you can answer, what exactly is an AHA, doctor?
So AHA stands for alpha hydroxy acid, and there's many types. There's glycolic acid, lactic acid, malic acid. Basically, what this is, it's a chemical exfoliant, superficial layers of the skin, and it gets rid of dead skin cells. So this leaves bright, more vibrant skin underneath.
So what kind of people can they use, must use an AHAs?
So AHA I would recommend to people who have more sensitive skin and just kind of want an overall exfoliation. I would recommend using it not every day, but maybe once a week or 3 times a week. And just kind of a good way to just help with the health of your skin.
Yes. Now let's talk a little bit about BHAs, and nowadays there are also products which are AHAs and BHAs. They both are mixed. So can you please exactly tell us what exactly is BHAs and what kind of people can use BHAs?
So BHA is beta hydroxy acid, and this is, for example, salicylic acid. Now, the way this works is similar to AHA, is that it helps exfoliate the skin, but the difference is it goes a little deeper. It goes to the level of the pore. So it helps clear out the dead skin deep into the pore. So this is great for people who suffer from acne. So the products that combine both AHA and BHA gives you both that acne clearing effect plus that kind of glowing exfoliating effect.
Yes. Let's talk about retinols. Retinols are, I think since 2 years, everybody wants to use retinols. And, people from 20 are starting to use retinols. Can you please tell us what exactly retinols are? And from when can they start using it? And what are like the side effects? Some people do say that there are side effects from retinols. Is it true? Please tell your views on this.
So I love retinols. Retinols after sunscreen, it's the best thing for anti-aging. So retinol is basically a form of topical vitamin A, and it works by speeding up cell turnover. So it takes about 28 days for the skin to go from the bottom to the surface of the skin, and retinol just speed that process up. So if you have acne, it speeds up the process of getting rid of the acne. And also just gets your skin, another benefit of it is it increases the collagen in your skin, which makes your skin thicker and less likely to have fine lines and wrinkles over time. It does cause a little bit of sensitivity. It's a strong medication. So if you do use a retinol, I would slowly ease your skin into it. So I would start with a little bit, maybe once a week. And then if that doesn't cause any dryness, redness, then go up to 2 times a week. And then do that for a couple of weeks and then go up to 3 times a week. I wouldn't do it more than 3 times a week.
Yes. So, doctor, are you suggesting that retinols can be used once, from what age do you think it's perfect for somebody to use retinols?
So I prescribe retinols for all ages, usually starting at age 9 because it does help with the acne part, the blackhead, whitehead type of acne. But for anti-aging effects, I would recommend starting in your mid-20s.
Yes. Another is vitamin C. Every product nowadays has vitamin C. Some say it clogs pores. Can you tell us, is that true? And who should be using vitamin C?
So vitamin C is an antioxidant. So the benefit of this is it helps protect your skin from pollution, toxins in the environment. Because I live in New York City, I tell all of my patients, you have to use vitamin C in the morning. Vitamin C, it can clog pores depending on the product you're using and how thick the serum is. So I always recommend if you are to buy vitamin C, which I do think everybody should do, you want to make sure it's very thin and that it's more than 10%. So just read the label and make sure it's higher than 10%. And that way you know it's going to be effective and safe.
Yes. Now, doctor, let's talk about SPF, which is considered like one of the lots of skincare. Everybody has to use an SPF. So can you tell the viewers watching the show, why is an SPF super important in, everyday skincare routine, and what are the benefits of SPF?
So SPF is the most important thing in your skincare routine. It helps protect your skin against sun. And a lot of people think, oh, I have darker skin, I'm not at a risk for skin cancer. But that's not the only thing that sun does. Sun also causes pigmentation, it increases inflammation in your body, and it leads to premature aging. So you get wrinkles and fine lines faster than you normally would have because of the sun. Now, with acne, this is really important because if you have a pimple and you expose it to sun, what can happen is once the acne is gone, you can get a little spot of brown. The brown pigmentation. We call this post-inflammatory hyperpigmentation. So if you have any skin condition or you're concerned about aging or skin cancer, then I highly recommend that you use sunscreen. And I would say do 30 SPF or above.
Yes. So doctor, also there are different kinds of sunscreens available in the market. One of the most popular ones are mineral sunscreens, and there's a normal sunscreen. So can you tell us what exactly is mineral sunscreen?
There's 2 types of sunscreens. There's chemical or physical. Mineral fine is more of that chemical type, and it's just different ways of protecting your skin from the sun. So the physical sunscreen is the sunscreen that has titanium or zinc. These are metals. So when the sun hits your skin, it bounces off the metal. Chemical sunscreens like PABA, oxybenzone, what they do is they have a chemical enzyme in it. So when the sun hits, the sun is converted into heat and released from the body. So it's a chemical process that protects you from the sun rather than a metal that protects you from the sun. The big difference is the chemical sunscreens, they tend to not have that kind of whitish tinge on your skin when you apply it. And the physical sunscreens do have like a little bit of whiteness when you put it on. It's a little bit thicker.
Yes. So doctor, can you suggest, now that we know that you've learned culinary arts, and you learned how food is important. So can you tell the viewers watching the show right now about what are some great foods for your skin? Let's start basically, how about, can you suggest food for, people with acne? And then, maybe somebody who's suffering from eczema, rosacea, psoriasis, maybe, what are the foods that they must eat?
So for acne, you want to avoid processed foods, sugars, and dairy. Those things can hurt your acne. Foods that you want to add are healthy fats, fruits and vegetables, especially cruciferous vegetables. These are like kale, broccoli, cauliflower. They're very powerful in helping calm down acne. And then kind of a general overview of all the other skin conditions. Really, the key things you want to look for in a diet is avoiding sugar, avoiding processed foods. There are specifics, like for example, with rosacea, licorice, especially licorice tea is really good, or green tea is also very anti-inflammatory. For eczema, healthy fats and drinking oolong tea is really good for that. For pigmentation, like carotenoids, so that's your like carrots, your mangoes are really good. And then for aging, I really like to recommend almonds, and also mangoes have been shown to decrease signs of aging.
Yes. So doctor, can you explain a little bit about rosacea and, dry skin? So can you explain us what exactly is rosacea, eczema, and psoriasis also?
Rosacea, it's a combination of inflammation and vascular reactivity. So basically, your blood vessels are just highly reactive to the environment. So if you get sun, if you drink something hot, if you eat something spicy, your blood vessels just tend to get very, very hyper reactive, and you see this flushing and visible veins on your face. And best way to treat it is a combination approach. So using technologies and lasers that actually burn blood vessels from your face so your skin is clear, plus topical medications and lifestyle. So making sure you're avoiding those hot foods or avoiding spicy foods and eating foods that are protective. Like, interestingly, dairy actually helps calm down symptoms of rosacea. And then psoriasis is an autoimmune condition where your T cells specifically are attacking your keratinocytes, which are your skin cells. And what you get is these thick, itchy, red layers of skin on the top of your skin. And finally, eczema, it's a condition where there's an issue with the skin barrier. So the skin is supposed to separate and protect the inside from the outside. But in eczema, you're missing a protein called filaggrin. So toxins and chemicals and anything from the outside is more likely to get into your skin and cause a really severe itch. And this leads to redness and a rash.
Yes. So doctor, this is a little personal, but then can you tell us how did you get into dermatology, and how did you start this journey, and what made you interested into dermatology?
Yeah, so actually it was my own personal journey through loving my skin that got me into dermatology. I suffered from very cystic, painful acne, and this led me to having a lot of scars on my face, and it was really horrible, and it made me really very insecure. So I went to my dermatologist, and we did a bunch of lasers and I use many medications, and my skin is now like this. Dermatology has made a huge difference in my life. And then I also did severe and currently suffer from severe eczema. And whenever I get stressed out, it shows up. My hands get dry and scaly. And I've noticed that changing the way I eat and being really good with skincare products makes a big difference. So that's what made me seek out dermatology and also more whole person approaches to skin.
A lot of people mess it up. So can you tell the viewers about the correct skincare routine or the correct basic skincare routine that everyone must follow?
So a good way to know your skincare routine and understand it is your morning skincare routine should be to protect your skin. And then your evening skincare routine should be to repair your skin. So the most basic is morning routine, a gentle cleanser, some type of antioxidant like vitamin C, a moisturizer, and sunscreen. And then in the evening, you want, again, a gentle cleanser, an anti-inflammatory serum. So if you have rosacea, something like niacinamide. If you're worried about aging, you want to use growth factors or peptides. And then you want to finish off with something to exfoliate. So a retinol or one of the AHAs or BHAs, and then finally a moisturizer.
Yes. So doctor, nowadays, people are getting a lot into food health wellness, health wellness. They want to, start their, fitness journey along with, they want to take supplements into their bodies. People are getting aware of the importance of great skin, of a great lifestyle. So can you suggest the viewers what are some basic lifestyles, some basic changes that they can do in their lifestyle for great skin and in general great health?
So exercise is great. I highly recommend that. It's good for your body and your fitness and health, but it also gets your blood going and your circulation going. And getting that blood flow will help bring the nutrients and vitamins that you're eating to your face and to your skin. So exercise is always very, very important. I talk to my patients about this all the time. Second is food, just being conscious about what you're eating and making sure you're eating well. Third, I would say is stress and just finding a way to decompress or making stress not be overwhelming. So finding a practice like meditation or talking to a friend if you're stressed out, doing something to just help calm your nerves. And then sleep. Sleep is underrated, but it's very important for your health, your brain health, and your skin health. And then finally, connecting. So making sure that you're staying connected with community, and just that will help with overall happiness, but also help with just calming down the stress and anxiety of the day to day.
So doctor, I wanted to know what are some medical procedures that you do, and especially, what are some things, some people are interested in Botox. Some say that, oh, if I get a Botox, my skin is going to look young forever. But then sometimes Botox is not really a good option, and sometimes they overdo it. So can you please explain us about different types of skincare procedures that you do to help people out?
Yeah, so I have a lot of procedures. Botox, I love Botox. It's a great medication. You want to make sure that you're going to somebody who's experienced and trained in it, because most people who have Botox, you actually can't tell. If you can tell if it's too much, if you're frozen, that means you just got bad Botox by a bad injector. So just make sure you're going to somebody experienced. I would recommend going to a physician. So I do Botox, I do injectables, which are fillers. I do microneedling. I do alt therapy, which is using ultrasound to lift the skin. I do Fraxel, which helps with sun damage. I do V-beam, which helps with redness and rosacea. I do Aviclear, which helps get rid of acne. I do pigmentation lasers that get rid of any type of pigment like melasma. And I do something called Aqua Gold, where I put Botox and fillers into the superficial layers of skin, and that just makes your skin appear more glowing. I also do cryotherapy, which is using very cold air to help bring back blood flow to your skin.
What are some laser treatments that they can get done, especially if they have acne and acne related problems? Once you get acne, there's something called as acne scars, and there's whitish and black. Something that people anywhere can get it done. What are some procedures and what are some facials that they can get it done?
Yeah, so acne leads to a few complications, I would say, on the skin. So one is redness, post-inflammatory erythema, which is just like this lingering red spot after an acne spot has gone. So there's a laser that gets rid of redness. And then if you have a brown spot, pigmentation after acne has gone, there's a laser that targets specifically pigment. If you have issues with texture, then there's Fraxel or microneedling that help smooth out the skin. If you have large pores because of acne, then again, I also recommend the Fraxel. And then finally, if you just have a lot of acne that you tried so many things and you're still dealing with active, persistent acne, there's Avaclear, which helps get rid of acne.
Yes. So, doctor, I clearly remember when I was reading your website, you clearly said something called as the mind-body-skin connection. So, can you explain us what exactly that is?
Yeah, so that goes back to the whole lifestyle approach to skin conditions in dermatology. There's a lot of evidence out there now that stress and anxiety leads to skin issues. For example, with eczema, it's very highly tied to anxiety. And they found that treatments such as massage and finding grounding practices can actually help reduce the amount of steroids you need for eczema and also reduce how itchy eczema is. And then with acne, stress is highly, highly correlated with acne. So learning to deal with your stress will help with that. So there are so many conditions like that where the way you feel, that the mind component plays out in your skin, like psoriasis, rosacea, lupus, acne, as I've said, hair loss. These are all physical manifestations of what's going on internally with the mind.
Yes. Finally, doctor, can you tell the viewers how can they get to you, and what are some treatments that you can provide to them?
All the treatments that I've mentioned, anything for skin rejuvenation, skin refreshing, or even face and body contouring, or even just working on the quality of your skin. I work in the West Village in New York City, and you can find me on Instagram at Dr. Asmi Sanghvi, just DRASMISANGHVI. And I post daily evidence-based facts on how to approach skin concerns using lasers, topicals, and other skincare practices.
Yes. Thank you so much, doctor, for coming on to our show. It was wonderful having you. Thank you for the viewers for tuning in. You're watching Sakshi TV with me, Shivani Raj.